And then we'll talk about the percussion and compression tests where, let's see, I'll click on that. In this case here, we're just tapping on the individual bones, but also, you'll see in a second, I'm going to be compressing both of the two bones together. So if you're compressing like this, you're pushing the tib and fib together, and then if they have pain on there, so that could indicate a high ankle sprain. All right, so one computer's going to unfreeze in a sec here. So as far as red flags, there's specific different things that you look at. There's listed. It's on the starts on the bottom of 162 and going into 163, where they can have pain on the medial malleolus. So basically, you're looking, if they twist their ankle, you want to figure out what's the potential of them having a fracture. So you're looking for tenderness in specific areas. You're looking at the medial malleolus, lateral malleolus, sometimes on the base of the fifth metatarsal, which would be here, posterior talocrural joint, so back into here. So they'll have pain like behind the lateral malleolus sometimes. So if you have pain in these specific areas, basically it's close to the bone. That might be a thing where you're going to suspect maybe they might have a fracture, you might need to send them off. And then, so anterior to the Achilles tendon, so if there's pain in this space here. Again, it's kind of surrounding the bone. If they have a lot of tenderness right on the bone when you've gone through an ankle sprain mechanism, you might suspect that there could be a fracture.
And what is this posterior sulcus?
Posterior sulcus. Later on, we'll get the picture up and we'll go over it again.
What's the WP stand for?
Anybody remember that? Weight bearing. So whether or not they can put weight on the leg.
PMH.
Past medical history. A lot of times somebody says, yeah, I've sprained my ankle a bunch of times and twisted it. So now we're getting into repetitive. So here we'll talk about plantar fasciitis. In this case, it's more appropriately considered a okay, here we go. So these are the different areas. Like I said, if you have the posterior side of the fibula and then posterior side of the medial malleolus over the navicular here. So if they have a lot of bone tenderness and bone pain around the ankle, you might suspect there could be a fracture. All right, so plantar fasciitis, I'd say it's more like an inert tissue because there's no real muscle contraction in it, but it does happen as a repetitive type of an injury. You don't usually get acute plantar fasciitis. I mean, you can get acute and flared up, but it's usually from repetitive motion. So during weight bearing, pushing off phase, somebody that's running a lot, you can get predisposed things if you have shortening of the Achilles or a flat foot. So a lot of times the way that's treated is with orthotics. A lot of times, like podiatrists or something, they'll do cortisone injections. But I would think that, you know, acupuncture needling in that area, maybe with some electrical stem or something like that could probably help. Plantar fasciitis is one of those things that tends to be chronic. It's tough to get rid of because it's like you say, well, okay, just stay off your feet. Yeah, right.
Both my dad and I had medicine had really good results with acupuncture. Also, like soaking your feet in like hot water with placing on it.
Yeah.
Really, really good.
Epsom salts, probably. So would they do like put needles right on the area?
It hurts so bad. Yeah, they're like, let me find the most tender spot. And then they're like, okay, just breathe in. And you're like,
Ouch.
but it went away. So, both of us.
So basically, what's happening is you're just getting micro trauma or tearing of the fibers of the fascia. Okay? It can get inflamed and be more acute, or it can just be a chronic type of thing. And then obviously the more, if somebody has a fallen arch, it's going to pull on that plantar fascia more. So they can have poor foot mechanics, overuse, pain with weight bearing, and then like I said, you're going to feel it in the morning, especially. That's when it's the worst. When they first put weight on it, you probably know. Right? So like what I tell people to do is like if you're treating them and they're wearing orthotics or something, it's like put your orthotics on as soon as you put your feet on the ground. If you're wearing slippers or something, just have them right there. Put your shoes on or something when you first get up. Because that's what happens with plantar fasciitis is that it just chronically gets continually irritated. As long as you keep irritating it, it's not going to go away very fast. All right, so now we're getting more into true contractile tissue issues where you can have Achilles tendonitis. Basically overuse, repetitive stress. You can have predisposing factors where some people are just going to have tight Achilles tendons. Pes cavus, did we talk about what that is? Pes as in foot, and cavus, that can be a high arch. So pes like a cave, so there's a high arch in this. Pes planus is flat foot, pes cavus is a high arch. And then also excessive foot pronation. So basically you're having microtrauma, repetitive pulling and tearing on the Achilles tendon. And a response to that, if it's more of a chronic thing, you're going to have thickening of the tendon. And over time, if there's weakening, like I say, it can all of a sudden you get Achilles tendon rupture. So repetitive injury, they can have tenderness at the tendon, pain, stiffness in the morning and pain. If you inspect it, there could be some thickening. A lot of times what you'll see is what's called a bump pump, where the Achilles tendon inserts on there. I think it's usually a little bit more medial. And then also it can be like if women are wearing high heels or something and it's put like a strap or something that's putting pressure on there. You can get a bump pump. Anybody ever have that? So yeah, different shoes can put pressure on that area. And then posterior tibialis tendonitis. This is one of the things that we talked about here where you look at the calcaneus. It should be a straight line between the Achilles tendon and the calcaneus. And this here, you would call this calcaneal, would that be valgus or varus? Valgus, because the distal part is moving away from the midline. Okay? And that's typically the picture of pronation. So tibialis posterior tendonitis, again, tibialis posterior is in the deeper compartment of the calf, and it comes around to the medial side. So they might have some tenderness along the, that muscle is coming down here. So we're talking about the irritation is more at the proximal end. So it's going to be, it's like a posterior shin splints. You can have anterior shin splints, we talked about that. This is more or less like a posterior shin splint. So it's where the muscle originates from on the tibia. Pain with weight bearing, tender to the touch. And it's usually the middle third of the tibia on the medial side. And this is where you can differentiate it between, you're going to have like a section of pain where it's going to be like here, posterior medial tibia, and usually in the middle third. And if you have tenderness over one specific spot, that's more of an indication of stress fracture of the tibia. Okay?